everybody, and welcome to today's session on the GPACI Puffin tool, which I'm really excited to be able to share with you all. So we'll give it a couple more minutes just for people to trickle in, and then we'll get started, which is super exciting. So thanks for all coming today. It's wonderful to see so many of you doing aged care work and supporting residents in aged care homes. And hopefully, after today's session, will make all of your lives a lot easier and managing your GPACI requirements will be much, much smoother. So here's hoping. All right, so we'll get started. All right. So first of all, I'd like to kick off by acknowledging the traditional custodians on the lands on which our work takes place. So here at Northwest Melbourne Primary Health Network, we are on the lands of the Wurundjeri Woiwurrung people, the Boonwurrung people and the Wathaurong people of the Kulin Nation. I'd like to extend my respects to their elders past, present and emerging, as well as adding Aboriginal and Torres Strait Islanders present in the meeting with us today. All right, so Puffin. We're all excited. You're wondering why we're talking about a bird. What Puffin is when GPACI started and we got all our lovely guidelines about what was going to be required in order to be successful for getting your quarterly payments, we realised that the administrative burden was going to be significant. So our colleagues over at Western Victoria PHN, who have been using the POLAR data support tool for a long time, actually worked with the makers of POLAR at Outcome Health to say, can we actually develop something to help our practices manage their GPACI requirements? The people at Outcome Health were very kind and said, absolutely, yes, we can do that. And as an added bonus, they also decided, well, let's include some information about vaccination as well. So not only can you manage your meeting and your visit requirements, but also keep up to date with their immunisations as well, which is really exciting for us. So you all know this much better than I do, but we'll do a quick refresher before we get into it. So obviously the GPACI requirements are providing those 2 care planning items every 12 months. And so it's those 4 types of, I like to call them fancy items. And then we're also doing those 2 visits per resident per quarter. They must be done in separate months within the quarter, and at least one of those quarterly visits needs to be done by the resident's responsible practitioner as registered in My Medicare for GPACI. So the good news is, how do you access Puffin? You already have it. So if you are familiar with your POLAR tool, and if you're not, talk to your practice managers in your clinics because they will be able to sort you out with a login code. When you log into POLAR, going into your reports menu, and then you're going to open the Puffin report. And then once you've done that, and we'll bring this across, and hopefully you can now all see my lovely Puffin tool, and this is Puffin. So what Puffin does is give you a quick oversight of what's happening in terms of your general practice in aged care incentive registered patients in terms of their visits at a glance. So we'll go through a little bit what this screen actually contains, and then I'll explain how you use it. So looking at this main section down here, so across the top, we have the GPACI payment quarters. For each of your patients, down the left-hand side, we have their name, we have their age, and then the blue bar indicates the current patient year. So obviously, GPACI has now been going for quite some time. We have different residents. They may be changing GPs to you, or they may be entering the residential aged care for the first time. And when you're registering for their GPACI period, their quarters obviously won't always align with the GPACI payment quarters. So that blue bar is telling you that patient's 12 months. On the left-hand side, we have the list of our patients at, providers at our practices that are providing GPACI services. And then across here, we have some icons that tell us what's happening. Now, when you come into it and you get overwhelmed, up the top there is a legend that will actually remind you of everything we're going to talk about today. So don't panic. It's good. All right. So at a glance, what this is going to tell us is Has the patient actually had an interaction in that quarter? And that's denoted by a little star. Now, this is a lovely fake practice with lovely fake data, and it's not as comprehensive as the data in your practice will be, but it gives us enough that I can show you exactly what we do. So where there's a star in that bar, that's telling us that that patient has had an interaction for that quarter, at least one, which is good. If I hover over it, and unfortunately, in this case, we're going to scroll down to one that corresponds. Oop, there we go. If I highlight over the top, it will then tell me when services have been provided. So let me find one that's actually got some data in it, because I did have one yesterday and now it's disappeared. That's very helpful. All right, we'll stick with this one. We'll go with there. Okay, so when I hover over this resident, so Luca Richards, who's a non-Indigenous male who's 87 years of age, I can see 4 care plan services. So in the patient quarter 1, the date that the service was provided, which service that is, and was it by the assigned provider. So gives us a start. At a glance, we can go, yep, okay, we've done one of those care planning or those fancy items already. On the right-hand side, it will then tell you if any one of those quarterly visits has been provided. And again, it will look similar to the care plan services. It will tell you which patient quarter it is, the date and the type of service that was provided, and whether or not it was by the assigned provider or not. So at a glance, we can see what's happening with that patient in terms of meeting their requirements. So I'll scroll up again. So we've got this as well. So the other thing we have is the lovely, I think it's a clipboard, looks like a clipboard to me. We have the little clipboard, and that tells us about our care plan status. And what you'll notice is that a couple of them are flashing red. So if I highlight over this, you can see down the bottom that we've got a warning. And what that is saying is that the patient hasn't had those care planning items that they're required to meet the annual servicing requirements. If we don't do that care planning item in this current quarter, we're then not going to get the annual GPACI payment because we haven't met the requirements. So we can see at a glance who are those patients that we really need to be targeting for a fancy item ASAP. The other thing you'll notice is there's little green dots. Perfect, here we go. So we can see 1 dot tells us that we have partially met the requirements. 2 dots will tell us that the requirements are complete for our annual requirements. So over here, so for patient Myla, so we can see non-Indigenous female, 86 years of age. We can see that they've had a quarterly visit. It was in their patient quarter 3 on the 10th of November and what service it was. We can also see that it wasn't by the assigned provider, which means that we know that next visit to that patient needs to be done by their My Medicare GP. Otherwise, we're not going to meet that quarterly requirement. So if you have 5 patients, this might be really, really easy to manage. If you're sitting here and going, my goodness, we look after hundreds of providers, how am I going to use this as a glance? We have filters, so don't panic. So there's a couple of ways we can look at our filters. Up the top, we have our filters menu, and if we click on that and drop that down, you'll see up the top we have some options for quick filter templates. So if I click in here, I've got options about how I want to filter those. So if I want to target those red flashing clipboards to say, okay, I need to be doing care planning items for this residence, I can click on this. I click my tick. The filter is now applied, which we can tell up the top. And you can see now my list has been brought down to those 5 patients that I need to do a care planning visit for. And it will also tell you who their My Medicare provider is. So you can give that list to your provider to say, okay, here's your to-do list for the next month. Other options in here, and you can build filters, so it doesn't have to be one, you can build others. So other ones I can look at, I can go, they need a flu vaccination and they haven't had any current visits in the patient's current quarter. So I can tick those. And so now I'm applying both of those filters, and I can see I now have a list of patients who need a flu vaccination and also need their quarterly visit done. All right, let me close it out. So if you are a multi-site practice and you're seeing residential aged care home residents from multiple locations, you can actually filter by practice. Obviously, we're just one fake demo clinic, but if you have multiple locations, they will pop up here, so you can filter through that way. The other way, obviously very usefully, we can filter by the assigned provider, or we can drill down into demographic filters. Address, so if you're seeing multiple residents at the one location and you want to create a residential aged care home list, we can do it this way. You can also filter by hospitalisation risk, which if you haven't watched, we do have a webinar that I ran earlier on the hospitalisation risk, or if they're due for a COVID vaccination. So lots of filters there. The other way we can filter, let's make this go away. So say I would like to see what Dr. Doolittle needs to do. If I hover over this info button, come back here, I can see that he has 3 patients, or she has 3 patients who hasn't completed their care planning requirements. I can see 2 patients who aren't up to date with their COVID vax, and I've got 3 patients that need to have their Shingrix. And as you'll see, as I highlight over them, it will then highlight in the table who those patients are. And if I click on that, it will apply the filter up here for you. Okay, so when you first open Puffin at your end, you won't have any patients. So unfortunately, there is no way to bulk import your GPACI residents from your practice software into POLAR. It is a manual process at this stage. Watch this space. Up the top here, you can see that there's a patient management menu. Now, if I click in here, what it will then bring me is my entire patient list from my practice software, so from my overall payer list. So you are going to have to set it up, but once you've set it up, you're good to go. So for example, if I'm going, I need to add in Mrs. Smith. So I can click in the little magnifying glass, it'll bring up my search. I type in the surname I'm looking for and click the box and apply my tick. It will then bring up all my patients with this surname Smith. I can find the Smith that I'm talking about, so we'll go with Dianara Smith. And if I click this plus button, this is going to record the patient as a GPACI patient. So it will take up to 48 hours for them to appear in your GPACI list. When you are assigning them as a GPACI patient, you will need to pick the GPACI payment quarter in which you registered the patient for GPACI. So remembering these are 2 separate processes. You still need to do the My Medicare registration, register the patient for GPACI in your HPOS, then you come across to POLAR and you enter that information here. It doesn't talk to each other. So say we went, let's go April. So it was registered in Q4. I also then set their My Medicare GPACI responsible provider. So let's go Dr. Richard Kimball, because I'm a Bruce Willis fan. And we click submit. And then what will happen is Dianara Smith, so you can see we've got a pending at the moment. Within 24 to 48 hours, she will then appear. There we go. Already come through, has come through into my GPACI list. And all of this will update within 24 to 48 hours. So let's close that off. Let's go back to our patient list. If you come in and you get stuck and you need anything, up here in the help section, the user guide will take you through step by step exactly how you use Puffin. There's also a support button down here if you have a specific question. Obviously, you're always more than welcome to email your primary care facilitator or give us a call here at the PHN and we can assist as well. So my one other caveat that I do want to throw out with this is remember that POLAR is based on the information in your practice software. So all your patient information, all their billing information, all their My Medicare status, all of that is reliant on what lives in your practice software. POLAR in this report does not talk to PRODA, doesn't talk to HPOS. So you're not getting any of that visibility of billing or information from PRODA. So just remember, information in your practice management software needs to be pristine, and then your POLAR will be pristine. All right, so brief overview. If you want to, I was going to say, more than welcome to take yourself off mute if you'd like to ask a question or pop something in the chat if you're feeling a little bit shy about talking in public. I've got the chat open, so I'll have a look. So if there's something in particular you'd like to see, please let me know. And for those of you where I am your primary care facilitator, you know I will fill in time and just keep talking. So, all right. I'm hoping this means that it's brilliant and you think it's fabulous and you know exactly how to use it and that it's really good. That's what I'm hoping. All right. Perfect. Okay, wonderful. So, welcome to Puffin. I hope that you found this really, really useful. Um, Obviously, if you go out and start to use it in your practice and you get a little bit stuck, please reach out. Please let us know. I will send an email out after this session that will have a link to the recording. I will also include the user guide as well. But please call us. We're more than happy to help. In fact, I'd love to come and talk about Puffin and not bulk billing practice incentive payment for a change. So please get in touch. But otherwise, if there's no questions, I will let you get on with your day. Oh, question. Love it. Hi, Lauren. How you going? Whoop, I'll let you take yourself off mute. Oh, can't hear you, Lauren. If you want to pop your question in the chat, go for it. That's all right. Technology gets the better of me most of the time. Pop your question in the chat and I can take you through what you'd like to know. Okay, so so I've got a couple of questions. So the first is, how do you find out which quarter you registered a patient? So when you go in through HPOS into my programs, into my Medicare, you'll bring up your patient list, and you can have a look there. What you'll probably find is at the moment that the vast majority of your My Medicare registrations are being done at the same time as your GPACI registration. So have a look at the date that the patient was registered for My Medicare, and that will generally correspond with the quarter that they're listed in. Otherwise, there is the GPACI list, which I will send you out a fact sheet because it's much clearer than me explaining it. Okay. All right. And I know there are some of our providers out there that are looking after large volumes of patients. At this stage, yes, they will need to be all added individually, but once it's set up, you're then done. So it's, set yourself 10 a day for the next year and we'll get to that 300. But yeah, look, and it would be lovely if we did have a way that could be done automatically. In the resources that I send out post-session, I will be able to attach how you can pull your list of GPACI patients from HPOS so that you've actually got a list. But yes, in terms of putting them into POLAR, it is a manual process at this stage. We're working on it, but obviously trying to get technology to talk to each other is a challenging thing. All right. Okay, any other questions? I was going to say, if there's anything you would like me to go over again, more than happy. But again, you're never on your own. You can always give us a call and let us know. All right. Wonderful. Well, in that case, we might leave it there. You can all have a little bit extra time back in your day to do some paperwork or, God forbid, have some lunch and a coffee. I think that's a much better idea. But as always, please, if you need any assistance, please call us here at the PHN, reach out to your primary care facilitator or send an email to our primary care inbox. We're always more than happy to help. But otherwise, wonderful. And thank you so much for your hard work looking after some of our most precious residents in our region and precious patients. So we really appreciate the work that you do. And I know their families do too. But otherwise, have a wonderful afternoon. Thanks so much.